Greetings, everyone. My name is Dr. Kingsley Bosompem. I'm a general surgeon and the lead in breast care in Holy Family Hospital. The month of October is Breast Cancer Awareness Month. And as we all know, breast cancer is the commonest malignancy which affects women all over the world. And the incidence of breast cancer is rising. According to global statistics, in the year 2022, there were 2.3 million new cases of breast cancer, with about 680,000 deaths. It is estimated that 1 out of every 8 women is likely to develop the disease in their lifetime. And it has also been projected that by the year 2050, there will be about 2.3 million new cases of breast cancer every year. In the Western world, the number of new cases are rising. However, death rates are on a steady decline because they have programs designed to detect the cancer early. In sub-Saharan Africa or in West African sub-region, death rate is very high. Causes breast cancer. The exact cause of breast cancer is not known. However, there are a number of risk factors. Number 1 is the presence of a breast, meaning that everyone is at risk, male or female. Number 2 is the female sex. It is more common in females than males. The incidence in males is about 1%. And also age. Breast cancer before age 20 is rare. From 20 to 30 is about 2%. Then the incidence rises steadily to about 80 years. But in Ghana, the peak incidence is between 40 to 49. Then we have what we call the hormonal risk factors. Breast cancer is driven by the hormone estrogen. So the longer one is exposed to estrogen, the more likely you will develop the risk, the more likely the risk of developing breast cancer. So this includes early menarche, early onset of menses before age 12, and then late menopause after 55. Late onset of full-term pregnancy and childbirth over 30 years. Then hormone replacement therapy, lack of breastfeeding. Other risk factors include family history of breast cancer and other malignancies, prostate cancer in males, obesity, alcohol intake, and smoking, and high fatty diet. How do we diagnose breast cancer? Breast cancer is diagnosed using what we call the triple assessment. It involves 1, clinical assessment, 2, radiological assessment, and then the third one is what we call the histopathological assessment. So with clinical assessment, we take history from the patient, trying to elicit signs and symptoms of breast cancer, which include lump in the breast, bloody nipple discharge, or skin changes. Then the patient is examined, where we look out for features of breast cancer, which include nipple retraction, skin dimpling, the presence of a mass with ill-defined edge, hard consistency, and the presence of lymph nodes in the axilla. The radiological assessment involves breast ultrasound for younger women and a mammogram for women 35 years and then above. The third form is what we call the histopathological assessment, where we use a special needle to take a little piece of the breast mass and is sent to the pathologist to confirm the presence of breast cancer. So with these three assessments, a diagnosis of breast cancer is made. Here in Holy Family Hospital, currently we have a comprehensive care for breast cancer patients, from screening, diagnosis, treatment, and surgery. We must remember that breast cancer is curable when it is detected very early. You don't have to wait until you notice all the symptoms and signs that I've already described. By that time, it will be too late or advanced. And the only way to detect breast cancer early is by self-breast examination and clinical examination every 3 months by a health professional who has been trained to do so. So we want to encourage every woman aged 18 years and above to perform self-breast examination. You examine your breasts every month, all women 18 years and above. And then 40 years and above, you are encouraged to perform mammogram once every year. When self-breast examination is performed and you notice any abnormality, you need to quickly report to the hospital for a qualified health professional to assess you. Remember that early breast cancer is curable. Thank you very much.